President Trump blocks Broadcom's takeover of chipmaker Qualcomm on grounds of national security. Spanish Repsol gas stations arrive in Mexico for the first time. Drug overdose deaths in the U.S. have tripled in the past decade. And a new survey reveals disturbing attitudes towards workplace sexual harassment. Hello and welcome to today's edition of Mexico News Network's Breaking News Business. I'm your host, Joseph Garza. Let's get on down to the information. U.S. President Donald Trump has blocked a planned takeover of chipmaker Qualcomm by Singapore-based rival Broadcom on grounds of national security. His order cited credible evidence that the proposed $140 billion takeover threatens to impair the national security of the United States. Qualcomm was already trying to fend off Broadcom's bid. Broadcom said it strongly disagreed that its proposed takeover gave any cause for concern. The deal would have created the world's third largest maker of microchips behind Intel and Samsung. It would also have been the biggest takeover the technology sector had ever seen. The presidential order said the proposed takeover of Qualcomm by the purchaser Broadcom is prohibited, and any substantially equivalent merger, acquisition, or takeover, whether effected directly or indirectly, is also prohibited. The chip-making sector is in a race to develop chips for the latest 5G wireless technology, and Qualcomm is considered to be a leader in this field, followed by Broadcom and China's telecom giant Huawei. Analysts said a deal between Qualcomm and Broadcom could have given Huawei the chance to take over the top spot in years to come, a situation U.S. politicians wanted to prevent given their ongoing security concerns around Chinese telecom firms doing business with U.S. carriers. But others have said Mr. Trump's decision was more about competitiveness than security concerns. Given the current political climate in the U.S. and other regions around the world, everyone is taking a more conservative view on mergers and acquisitions and protecting their own domains, said Mario Morales, Vice President of Enabling Technologies and Semiconductors at global research firm IDC. He said semiconductor technology and companies like Qualcomm will be an important weapon in the 5G arms race, and the U.S., like other nations and regions, wants to be first. In other headlines, the opening of Mexico to foreign investment in hydrocarbons as a result of the energy forum has led to the arrival of corporations with their own fuel supply franchises. One of them is the multinational Repsol, which has just opened its first gas stations in the country and promised an investment of 8 billion pesos. In addition, the company reported that it intends to cover between 8 and 10% of the national market. Its first gas station was inaugurated on the Picacho-Ajusco Highway in Mexico City, with the goal of opening about 250 stores each year to reach 1,200 petrol stations in 4 years. According to Repsol, Mexico is the 6th market in the world in terms of gasoline and diesel consumption. The company considers that with a population of more than 120 million inhabitants, the demand for fuel in this country is constantly growing. In addition, according to data from the Energy Regulatory Commission, 40% of Mexican municipalities lack service stations due to the fact that Mexico has only 11,800 petrol stations. That is one for every 10,560 inhabitants, a rate far below countries like the United States, Germany, and Brazil. On the sale of gasoline in Mexico, the company reported that it guarantees the quality of the fuels thanks to the controls they perform on a daily basis, as well as the additives they use. The company also stated that due to the mistrust of users for the poor service offered by other gas stations, the customer may request to be checked that they are actually receiving the liters marked by the dispenser. In other news, patients in pain present a daily conundrum for physicians. Each one is set against the backdrop of epidemic opioid misuse in the United States. Overdose deaths have tripled in the past decade, and addiction has grown into a full-fledged societal calamity, fanned by overindulgent prescription pens. Now doctors are pulled in opposite directions by an individual's pain and a society's crisis. The presence of drug seekers in virtually every physician's practice today has tainted medical professionals' thinking, casting doubt over clinical instincts to relieve suffering and making doctors suspicious of pain. By 2005, the approach to pain had changed. Aggressive treatment had become the standard of care. The rate and number of opioid prescriptions began climbing and peaked in 2012 with more than 255 million, at a rate of 81.3 for every 100 people in the United States. One study of emergency room physicians and their prescription processes revealed how many factors influence doctors' decisions to prescribe, including concern about addiction, their personal medical experiences, pressure from state legislators to curb prescriptions, and even worries over patient satisfaction scores. Some physicians feel administrative pressure to prescribe opioids more freely in order to improve their scores. The healing power endowed by the Federal Drug Enforcement Administration to physicians brings great responsibility, but not much insight into discerning disease from drug-seeking behaviors. Opioids are the nuclear power of pain killing, and their misuse similarly brings death and destruction on a national scale. If you know anyone that might be in need of help, please encourage them to call the Substance Abuse and Mental Health Services Administration at 1-800-662-HELP. That's 1-800-662-4357. It's free, confidential, 24/7, and available in English and Spanish. Moving on, a new survey has found that almost 1 in 4, 23% of men in countries around the world, think it is sometimes or even always acceptable for an employer to expect to have sex with an employee. The survey, commissioned by the nonprofit humanitarian organization CARE and directed by Harris Poll, was published on International Women's Day. It surveyed 9,400 adults in Australia, Ecuador, Egypt, India, South Africa, the United States, the United Kingdom, and Vietnam. Sexual harassment at work is not even illegal in almost a third of the developed world. According to the survey, 32% of women and 21% of men said they had experienced sexual harassment or work-related aggression. In India, a third of the respondents felt that it is sometimes or always acceptable to call out or dog whistle a colleague. And in the UK, 35% of people between the ages of 25 and 35 believe that it is sometimes or even always acceptable to pinch the backside of a coworker as a joke. About 65% of the women surveyed believe that the #MeToo movement will have a positive impact in their countries. In response to the survey, CARE launched a petition requesting the International Labor Organization to create new global regulations on freedom from violence in the workplace. CARE also presented a new hashtag for discussions about sexual harassment, #ThisIsNotWorking. And finally, let's take a look at the markets. The Mexican peso decreased 0.17% to 18.5736 from 18.6045 in the previous trading session. On the other hand, the IPC Mexico decreased 0.23% to 48,557 from 48,671 in the previous trading session. This was all for today. Thank you again for staying with us. I'm Joseph Garza. Remember to follow us on Facebook, Twitter, and Google+, and log on to MexicoNewsNetwork.com for more information on Mexico and the world. See you next time.